Hello, everyone, and welcome into Senior Living Live. My name is Melissa. We have a little bit of a different webinar to share with you today, a little less presentation and a lot more conversation. We have invited Dr. Donna Potts and Dr. David Potts to join us. Donna is an internal medicine physician, and David is a doctor of infectious diseases. Both were a part of the Moderna Vaccine Trial several months ago, and they are here to share that journey with us here today. So we want you to be a part of this conversation with us this evening with this fantastic husband and wife dynamic duo. So feel free to join in the conversation with your questions or comments. In order to do that, you can scroll down to the bottom of your page where it says Q&A. Type your questions or comments out there, and we will rapid fire with our couple who is, we are so grateful that they have taken the time to join us here today. Just a reminder to everyone that all video and audio lines will be muted throughout the webinar. So, David and Donna, thank you so much for taking the time to join us today to educate all of us on these vaccines, COVID, sort of where we stand now. So can you tell us how you both became a part or were selected to be a part of the Moderna vaccine trial?
Sure. And thank you, Melissa, and thank you for the invitation.
Thank you.
So Dave and I'm 65, he is 75, and we are in the waning times of our careers, but we still practice actively, part-time, taking care of HIV patients. And when back in March, when the pandemic hit and things were closing down, our practice partners told us that we needed to not come in the office for a while because of the risk, which we appreciated, but didn't really feel comfortable sitting it out. We've not sat things out before. And so we stayed home doing the telehealth visits while the whippersnappers that we work with did the face-to-face visits. And that was fine. But then in the summer, as we learned that the Moderna company was conducting one of their COVID vaccine trials in the upstate and had actually had a location in Anderson near where we live, we felt like that was a good way for us to contribute to the knowledge base. And we felt very comfortable with the safety of the messenger RNA technology, which is old technology. It's a new vaccine, but it's old technology. So we made some phone calls, and they called us in. And the way the trial worked was you, after getting your history taken and a physical exam and 8 vials of blood drawn, you got randomized to either get the actual vaccine or to get a placebo, which was a saline injection. And you weren't supposed to know what you got, but one of them hurt really and one of them did not. So it was not exactly a secret, right? So we were pretty sure when we got our first vaccinations, which was in August, our first shots, that Dave, who got a very sore arm, got active vaccine, and that I did not, because my arm, I didn't feel anything at all. And then his arm was sore for a day, and that was about it. A month later, we went in for our second injection. I once again felt nothing. He got a more sore arm that day, and then the next day felt pretty punk, just achy and tired and so on. That also lasted a day, nothing too terrible. Well, then when, as healthcare providers, we went back into the office in October. So we were once again actively seeing patients. You can't do telehealth forever. And when the vaccine was authorized by the FDA, as frontline healthcare providers, we were eligible to get the vaccine. So we called Moderna and said, we need to know, did we get it or not? So they broke the randomization code. And indeed, Dave had been vaccinated in the fall and I had not. So I got my first dose, and I will get my second one tomorrow morning. So soon I'll have my vaccine, and in another 10 days to 2 weeks, we'll feel like I'm protected, and at least a 95% level for severe COVID disease.
Right.
So yeah, so we're excited about the vaccine and hoping to encourage people that can get it to get it as soon as possible.
Sure. And with just to let everybody know, you mentioned Anderson, so you do live in South Carolina. Just
Right.
if people were wondering where Anderson is, it's in South Carolina. We have people who tune in from all over the place. So let me turn to David, because we have questions. Obviously, a lot of people have questions about the coronavirus vaccines. And since you had it, you may be some of the first person that they have seen or met through this webinar that has had it for this period of time. It's been 6 months,
Correct.
essentially, since you received perhaps your first dose of vaccine. Have you had any adverse reactions or issues after receiving this vaccine?
I got the first dose in August, the second dose in September, so I've been vaccinated for about 6 months. You're continuing the study probably forever. They're going to continue drawing blood from me periodically to see how long I keep antibodies, to make sure that I don't become ill, because there's a lot of things we don't know about the vaccine. We really don't know how long it's going to last. Is it going to last for 6 months? Is it going to last for 20 years? We don't know. So they're continuing the study to figure out how long it's going to last. Also, the study was only done to look for severe symptoms or hospitalization. It was not done for mild symptoms. It was not done to see if you could still give the virus to somebody else. It had a very limited scope in the way this study was done. I actually developed a cold about a month after my second vaccination. I called them and said, should I come in to get tested? They said, no. Are you very sick? I said, no, I'm not sick at all. I have a cold. They said, well, then we don't need to see you. We're only looking for severe symptoms or the risk for hospitalization. So it's a great study, and we surely recommend everybody get the vaccine, but there's a lot of things it doesn't really address when you do that. But your question, I've had no significant side effects. I had a sore arm with the first one, a little bit of swelling, a little bit of a sore arm. After the second one, I felt a little badly for a day or so afterwards, a little low-grade fever. I tell people I didn't go to work because I was so sick, but actually I don't work anyways, so I didn't go to work. That's true. But if I needed to go to work, I would have. I really wasn't very sick at all. I just had a little bit of, I just didn't feel good. I took a nap, which I never do. But other than that, I have had no symptoms, no trouble at all. And I actually feel better knowing I've been vaccinated. I'm still careful. I still wear my mask. I still socially distance, but I feel a little more confident if I'm walking the grocery store and that person walking towards me doesn't have a mask on. I'm a little more comfortable than I would have been before I got the vaccine.
Absolutely. So quick follow up there, and then I'm going to go back to Donna, because now Donna's in the midst of it, as many people are now at this point in time, receiving the first dose, and now your second dose, as you said, tomorrow. But David, does the study continue in terms of do you have antibodies at this point right now? I mean, do you still have? Are you still protected against the virus 6 months later?
I don't know. They know probably. They take blood from it, but I don't know. I don't know the answer to that question. We don't actually know if you need to have antibodies to be protected. There are some viruses that hepatitis B, if you get hepatitis B, if you've been vaccinated at some point in your life, if you ever developed antibodies, you're protected for the rest of your life, even if they can't measure your antibodies down the road. So we're not even sure you need antibodies to be protected. The virus has been around for a year. There's just huge numbers of things about this whole process that we don't know.
And being an infectious disease physician, a doctor, where can you put COVID? What kind of box can you put it in terms of things that have cropped up or popped up in the past? What does it look like? Does it look like anything else, or is this something that is completely new, different, and, as you said, still very well unknown to this point?
You probably shouldn't get me started.
Uh-oh.
No, I mean, it's different. It's a very common virus. The corona means crown. It's a virus with a little bit of this S protein that you hear about. It's got a little crown shape to it. That's why it's called a coronavirus. But it's the same virus that causes about 30 or 40% of the common cold. Coronavirus does that. It's the same kind of virus that caused SARS and MERS, that caused some of the other diseases we've seen recently. So we know a little bit about it. Some of what we know is a little distressing. We know that if you get a common cold and you're immune to get that same cold again, but only for about 6 months or a year, immunity doesn't last after you've had it. That makes us a little nervous. Will immunity last with the vaccine or with the disease? And the answer is we don't know. We need a booster on a regular basis. Will these varieties we're seeing, these changes, the variants that we're seeing, is the same vaccine going to work for those? Could you catch one of those even if you've already had either the vaccine or the disease? We don't know. There's just huge amounts of information. The reason the study's going on is to help determine some of those things. They're going to keep talking to us. They're going to keep taking our blood. If we get sick, we're supposed to call them, and they're going to go in. They're going to test us. Do we have the same strain, a different strain, something totally unrelated? So it's very different than other kinds of diseases. It's also a very different vaccine. The vaccine is a whole new technology. It's a messenger RNA vaccine, new technology to the vaccine world. That kind of activity has been used for cancer before. We know it's safe. They've done cancer therapy with that same technology, but not vaccines. It's a really remarkable breakthrough because you can develop it so quickly and you could change it quickly. If this new variant comes along within a week, they could make a vaccine that would be effective against the new variant. Unlike flu vaccine that takes 6 months to make a new strain of vaccine, they could make a new one very quickly. Hopefully they don't need to. So making the vaccine won't be the problem, but distribution could be a terrible problem. But making the actual vaccine is very simple.
Yeah, and we hope that with some of these vaccines that are hopefully will quickly get approved by the FDA that are one dose and don't need the significant temperature storage, that maybe that will solve that problem. But Donna, going back to you, since you recently had your first dose, now you'll have your second dose. How did you feel? What was your reaction to the first dose?
My arm was a little sore, but I wouldn't have even, if I hadn't known I had the shot the day before, it's not something I even would have noticed. Some people do get more of a reaction, but I did not. The shot itself doesn't hurt at all going in. Some vaccines, when they go in, they sting or are uncomfortable, but it's really pretty benign itself.
A lot of your people have probably had the Shingrix vaccine, the shingles vaccine.
Yes.
People equate the reaction to this vaccine similar to the reaction to the Shingrix vaccine. People that have had sore arms, a little bit of fever after the second Shingrix vaccine. It's a very similar number of people and kind of reaction to the shingles vaccine.
Yeah. We do have one question, and that is, and this is for either of you to answer. Should people who have already had the virus get vaccinated when they have the chance to do so?
Yes. And the reason is it seems that the immunity from the vaccine is actually better than what you get from the illness, particularly if you've had a mild case. Different states are making different rules and giving different recommendations for the vaccine. In South Carolina, our health department is recommending that people wait 90 days after if they've been diagnosed, in part because they're presumed to already be relatively protected and the vaccine is in short supply. So that's the official recommendation. It won't hurt to get it, but it does give a longer lasting, a more robust immunity than the illness itself.
Right. And this really put both of you out on the forefront. As you're in the medical field, you see people, as you said, there was telemed, and then you actually had to go back into the office to see your patients. So what are you hearing from people as it relates to the vaccine, the good, the bad, and the ugly?
I mean, a lot of people have a lot of reluctance to taking the vaccine. Unfortunately, it's some of the people that need it the most that are the most reluctant. People of color have had a bad experience with our healthcare system over the course of tens, decades, generations, perhaps. And so they have a real reason to be leery of the healthcare system in general. So there's a significant reason why they're leery. We encourage people to take it. We surely don't make them take it. COVID vaccine is not mandatory any place. Flu vaccine is mandatory in many places for healthcare providers. This might be mandatory for those kinds of people someday, but it's not really fully approved. It has an emergency use approval. It's not a fully approved FDA product at this time. So we hear some people who are reluctant, people that have taken it. I've heard no serious complaints from anybody that's taken it. People talk about these rare reactions and this kind of stuff. I went with an elderly lady from our church to help her get the vaccine a while ago, and they had us wait in this waiting room for 30 minutes and 15 minutes over here. It was a joke. Everybody was sitting around telling stories and laughing, and there wasn't even a hint of any kind of a reaction to the vaccine from either the first or second dose. It's appropriate then to be careful to make sure there's no reactions, but I mean, there must have been 50 people that came through there while the two of us were there, and there wasn't a hint of any significant reactions from any of those people.
Just because you get the vaccine, we still, again, don't have all the information. We don't know if you can still get the coronavirus with it. You just won't know because it won't affect you in the way that it's affecting so many hundreds of thousands of people. But you could still possibly give the virus to someone else. So,
Right.
what are the safe practices that you're telling people to continue to do, even if they are vaccinated?
That's correct. And I would be really reluctant to go visit an 80-year-old great grandmother or a 100-year-old, but I'm going to visit my 12-year-old grandchildren. I probably won't give it to them. And if I did give it to them, they probably won't have any particular ill effects from it as children. So I think we're still being careful, but I think for most people, us included, there has to be some reward. Most of us like some reward. You get this vaccine, number one, so you won't die, but number two, because it allows you. So I've been a little unhappy with the official mantra out there that we shouldn't, everything you did before, you got to keep doing it. Yes, but maybe you could ease up a little bit and go visit your grandchildren.
But for me, so when I'm vaccinated, I will be protected, 95%
Yeah.
protected from severe illness. I could still get a minor case, possibly, and shed virus. We don't know that. That's being studied. It's possible that that's not. Maybe being vaccinated, you don't get mild disease and shed virus. So I will be protected, but my patients and other people that I'm around could potentially, I could still be shedding virus. So I need to wear my mask and distance and do all the normal thing to protect them. But
Yeah.
that's a different mindset than thinking all the time that you yourself are at risk.
Sure, sure. And along those lines, we have another question, and this is up for either one of you. Again, it's so nice to have a to have a husband and wife team like this that has been a part of really what you did was selfless to help the rest of us move forward and hopefully living a normal life once again. But the question here is, do you know how we can find out if we have antibodies already? And if we do, should we still get the vaccine, or is that enough protection?
I mean, you can find out. It's a blood test. Your doctor can order the blood test. If you give blood, they do the blood test as when you give blood. It's one of the incentives they give you when you go donate blood to the Red Cross. So you can find out that way. Or your doctor can order the test for you. Even if you have antibodies and you're eligible for the vaccine, you ought to get the vaccine anyways. So I don't know any real reason to find out if you have antibodies or not. It's interesting epidemiologically to figure out who in the community has already had the virus. At some point in time, we assume that when 80 or 85% of people are immune, the epidemic will be controlled. So the scientists want to know who's immune, but for the individual person, I'm not sure it makes much difference. I don't know what you're going to do differently if you find out you do or don't have antibodies. Go get the vaccine anyways.
Yeah, and we don't have any. So antibody tells you if you had COVID or not, but it doesn't tell you if you're immune because we don't really know how antibody level correlates with immunity.
So people fear the disease because of death, right? They don't want to die from it, but there are the long haul symptoms, and that is something that I would, if you know anything about that, I would love to hear your thoughts on maybe that's the thing to fear the most. Is getting sick and then being someone who still has all these lingering symptoms 6, 7, 8 months out.
Yeah, that it happens a lot. It happens, the more severe the disease, the more likely it is to happen. But it is a serious problem. Even with fairly mild disease, people can have some symptoms for a long time. Fatigue, headache, a little short of breath. There's officially 55 different symptoms that have been associated with it. But yeah, and that's a serious problem and a good reason to try not to catch it. There is nothing to make us think that those come after vaccination. They were a little concerned if you get them after the disease, could you get those after vaccination? And they're in people like myself that have had it for a long time now, there is nothing to suggest that those symptoms are caused by the vaccination. So that's good news. So
Yeah, that's an excellent point. Excellent point. So if anything, get the vaccine just for that. So you can keep your sense of taste, you can keep your sense of smell, you can walk, you can go back out running and jogging and doing all the things that some of these individuals who got a serious case of COVID can't do anymore. So here's another question, and again to either one of you. Marvin wants to know: is the measure of efficacy percentage who do not exhibit even minor symptoms, or is it the percentage who do not experience need for hospitalization or death?
In between, it's people they don't get serious disease or hospitalization. So, but mild disease, sore throat, runny nose, I don't feel good has not been measured. It's serious disease, short of breath, fatigue, not necessarily hospitalization, but almost hospitalization or hospitalization. It's not mild disease.
Okay. So then the bottom line question is, why, what reason would someone have? And there are probably people out there who should really consider getting the vaccine. You know, we still don't know about pregnancy, right? So we're still trying to get information about that if you're pregnant. But is there any reason not to get the coronavirus vaccine?
No. In pregnancy, although you're right, there's things we don't know. We don't know about children. We don't know about pregnancy. We don't know about severely immune compromised adults, people with cancer and immunotherapy drugs. We don't know about those people because they haven't been studied. But they've done a recent survey of OBGYN doctors who are pregnant, and all of them got the vaccine. So the OBGYN doctors think that the vaccine beats having the disease while you're pregnant. There really is almost no contraindication to it. There's things we don't know, but that doesn't mean that it's a contraindication. We tell our HIV patients, there were a few HIV patients in this study. They were not excluded, but there weren't huge numbers, but there's no reason to think they shouldn't get it. There are very few, if any, people that shouldn't get, unless you're allergic to some of the components of the vaccine, but in general, people should go get the vaccine.
Women who are practicing OBs who themselves are pregnant and are eligible for the vaccine are all getting it. So that tells you women physicians who are pregnant are getting the vaccine if they're frontline healthcare workers and are eligible to get it. As far as the vaccine, you know, some people say, well, I have an egg allergy, or there's things that they've been told for other vaccines. With this one, it has polyethylene glycol, PEG, in it. So people who know they're allergic to that, could have a concern mostly about a local reaction. The recommendation is if you've ever had a severe reaction to any vaccine, that you be watched for 30 minutes after the vaccination instead of just the 15. But that's about it. I mean, it's amazingly safe as far as immediate allergic reactions.
And you answered the next question I had, which was about David had mentioned any potential allergies, and then it would be, well, what could those allergies be? Because there are millions of people who have allergies and want to be sure that that's not going to be triggered by receiving one of these doses or two of these doses, or if it's just the one dose from Johnson and Johnson. Now let's talk about children quickly, because I know that we talk about the specific populations of people who are able to receive the vaccine. Currently, that's adults. Why not children right now? What is are we still looking at the data on that, or why just adults?
There is no data. They have not been studied. The Pfizer vaccine went 16 and up. The Moderna vaccine went 18 and up. There is no data. It would be nice to do that. Some diseases, pneumococcus appears to be spread, influenza are spread primarily with children. If you want to prevent old people from getting those two diseases, you vaccinate the children. We don't know if that's true for this disease or not. We need to get the children vaccinated, partly for their protection, but partly so they don't give it to their grandmothers.
Yeah, absolutely. Now, for those of you who are joining us, so far, great questions. Continue to ask those questions. You can scroll down to the bottom of your screen where it says Q&A. You can type out a comment if you have something you'd like to share, or a question for the doctors who have been so kind to join us here today. So, one thing we did touch on just slightly was supply. And that has been a problem because the supply, not enough for the demand that thankfully we have for these vaccines. What, in your opinion, both of you, what can be done to help that part along? Because that seems to be the blockade right now.
Not part of my pay grade.
That's fair enough.
I wish I could help that along, but
Well, so the production needs to be geared up. There were supposed to be 100 million doses available by the end of December, and I think that I read that 20 million got shipped. So it's been harder to get production geared up. And then when production got geared up, I mean, in South Carolina, you know, we didn't have everything in place as far as the infrastructure. Um, uh, you have to go to the CDC website and fill out the VAMS form, which if you've done that, it's extremely cumbersome and you get bumped off, and it's not real user friendly. Um, the other thing that's frustrated me is, in South Carolina, our 1A, our frontline healthcare workers, people living in long-term care facilities, and employees, and and then people over the age of 70. But you have to have internet access. You have to, you know, be pretty good at using a computer, and you have to have a cell phone so you can get a text message to verify your information. Then you have to capture the QR code to take it with you to get scanned. I mean, that's a lot to have to do. The phone calls, folks are telling me they're holding for an hour or two until their phone dies, you know, trying to get through on the phone line. So we just weren't geared up like we should have been for the volume. And now we've got in place in South Carolina the mechanisms and the facilities and the staff to do it, and we just don't have enough vaccine. I mean, South Carolina gets allocated 60,000 doses a week, and one big hospital system asks for 58,000 of those.
Wow.
Yeah. So obviously we just need more. We just need to get that. So it started out, we weren't ready to roll it out. Now we're ready to do it, and we need the vaccine.
Right.
So we're playing catch up.
Yeah. So let's talk. No, go ahead, David. Go ahead.
As an opinion, I mean, in my opinion, a well-to-do country like us ought to be able to figure out how to manufacture all the vaccine that we could possibly need. What, I don't know if you have to pull up some defense act. I have no idea how you do that, but it's just hard for me to believe with all the capacity we have that we can't make enough vaccine. But it's a bigger problem than we realize. If we don't vaccinate the whole world, this is going to be an endless problem. Vaccinating our country is clearly very important, but if we don't also get Europe and Africa and Asia, I mean, we get supplies, we get people, we get goods from all over the world. Planes come to this country from everywhere, and if we don't, vaccinating us is clearly important for the 400 million of us, but that's the tip of the iceberg. The billions of people on the earth have to be vaccinated if we're really serious about it. And the more people that have the virus, the more opportunity there is for the virus to change and become more virulent. If people don't have the virus, if the virus is gone, if the majority of people have very low levels of virus or no virus, if you could actually do case contact tracing, which is what we started out thinking we were going to do, where if you find somebody with the virus, then you find all their contacts, and then you isolate all those contacts and you test them. And in our country at this moment in time, that's impossible. There's so much disease that you can't possibly find all the contacts of all the people that are infected. But getting vaccine for us is very important, but we keep talking in the whole country about 400 million doses. We need 7-8 billion doses in order to vaccinate the world. We are not sufficient, number one, because it's a worldwide problem. Number two, just ethically or morally, to not vaccinate others is
Mind-boggling. Yeah. I mean, yeah, I agree with you 100%. So let's go back to what you said about the variants. So what do you know about the variants? Are they mutating into, is it mutating into something worse, or just maybe more easier to catch, but the symptoms aren't as bad? I mean, what are we seeing so far in terms of the new variants that are out there right now?
So it's still early days. The variants that have been identified, so there's the Dave was joking earlier that we're not supposed to call it the UK variant or the South Africa variant, but it's either that or B117, right? So the one from the UK.
They got to give it a better name. They got to call it Sally or something. If we're going to remember it, I'm not going to remember B1117.
So the one from the UK that is probably going to be the most common one here by the end of March. That's the one that seems to be more transmissible. The vaccine still works against it. Initially, we were told that it didn't cause any more mortality, and there's a small study out of Britain that raises some concern that that may not be the case, but we just don't know because it's small numbers. But it's for sure more transmissible, which is scary because it's already extremely transmissible, right? The South Africa variant, South Carolina has, we have the distinction of being the first place in the country that had that. So we had 2 cases here, and there's going to be more. I mean, you know, That's the nature of the communication of the world. And it does look like the vaccine is still effective against it. It's a little bit less effective, but the vaccine is so powerful that that smaller degree of efficacy doesn't seem to make any difference in prevention of disease. But you know, it can keep, as long as there are millions and millions and millions of cases, it can keep mutating. And the concern is that we will end up with a variant that has outsmarted the vaccine. It could happen. So far, the vaccine works against all of them, but certainly we've got to worry about one coming along that either people who have already had COVID can catch, or that vaccination doesn't work against. So far, it hasn't happened. So it's really a race against time to get as many people vaccinated as possible. You know, if we could cut down, if everybody would just do what they needed to do in terms of mask distancing, you know, hand washing, we could do more faster than we're able to do rolling out the vaccine. But human behavior is hard to change, right?
It is, and I want to go back to a point here as we start to wind down about what David said. You know, this could have so many variations, and if we aren't vaccinating not just the people here, but everywhere, because it is everywhere. It is never going to go away. Okay, so and the way that that goes away is really through vaccination, because it has proven so far to be the one thing that will prevent the spread of this disease. At least that's what we believe so far. So I guess in final closing thoughts for both of you, what would you say to somebody who may be watching, who is maybe on the fence, that can really get across the importance of getting vaccinated against the coronavirus?
Go for it, dear. No, I mean, you've said it, Melissa. You've said, but the only way we're going to control this disease, the only way we're going to get back to normal, whatever that is, where
Yeah.
we can have our grandchildren to take a trip and we can do those things that we want, have dinner with our children indoors instead of on the porch freezing to death. The only way we're going to get to that point in time is to get the virus under control. And the two things that get under control is vaccination and then following the guidelines. I mean, just before we got on here with you, I went to the Dollar General to get a few things. And since we knew I was coming here, I counted. There were 12 people I encountered in the Dollar General. 5 of them did not have any masks.
Wow.
As long as we're in that point of time in rural South Carolina, vaccine is not going to do it. I would guess, if I had to guess, that those same 5 are going to not want to get the vaccine for whatever reason. I don't know that's true, but I tend to think that's what happens. I mean, we have to do all the things we have to do, because I think you're right. This virus also lives in non-human species. It lives in bats and camels and dogs, and any virus that has non-human hosts can never be eradicated. The only viruses we've ever gotten rid of were those that had no non-human host, smallpox, because there was no place for it to hide. And if you vaccinated all the people, then you could get rid of the disease. But this virus is always going to be around. We have to keep it suppressed. We're not going to cure it. It's not going to disappear. Can I make a pitch for one other thing before we get off the air?
Absolutely.
There's now a process of getting monoclonal antibodies. Monoclonal antibodies are designed to be given to people who are at high risk of getting seriously ill or being hospitalized, but they have to get it very early. So we're primarily talking about the elderly, over 65, over 80 for sure. If they get symptoms of COVID or think they've been exposed to COVID, they should go get tested immediately. If it's positive, they should get their healthcare provider to line them up to get an IV infusion of monoclonal antibodies. It has to be done early. If you become seriously ill, they won't work, but we could markedly decrease the seriousness of the disease in high-risk people. It's not easy to do. It's a 1-hour infusion. You have to go to a special place to get it, but it's available now most places in the country, not easily. You're going to have to get your healthcare provider to do a little work to find out where. In our area, I know all the places. I don't know all the places where all of you live, but people at high risk for serious disease who get COVID should get that done immediately, tomorrow, not next week, tomorrow. That's hard because sometimes the tests take a long time, but they should get on it and get it done. It'll save lives.
And in terms of the vaccine, I mean, I just say the best chance we have of getting life back to something even close to what used to be normal is get vaccinated when you're eligible and follow those precautions that we all know by now.
And so if somebody's waiting because they said, "Oh, well, I'd rather have the one dose," I want to wait for the Johnson and Johnson to come out. Does it matter?
Go get it. Go get it. Whatever you can get, go get it.
Big thank you for sharing your journey, David and Donna. It's people like you, as I said earlier, who have really selflessly paved the way for these vaccines to be widely available around the world. And with these vaccines, we hope that if everybody can decide they want to get one, we can hopefully put COVID in the rearview mirror. That's certainly what you were a part of the trial for, so that we could get these vaccines going and that people can get the shots in arms and we can move ahead. So thank you so much for taking the time today.
Thanks, Melissa, for doing this. Hopefully people learn something.
Sure.
Thank you.
Our pleasure. Thank you.
Thank you. And as always, we appreciate you watching Senior Living Live. You can hop over to our website at www.seniorlivinglive.com for more content just like this for your viewing pleasure 24/7. So thank you for joining us, everybody. Have a great day.